Glad to meet once again. A hearty welcome on behalf of WCOP to the 9th session of WCOP 3-month training program on school counseling. I heartily invite our Chief Patron, Professor P.V. Ramamurthy Garu, Chief Patron and Chairperson, WCOP, Professor Girishwar Mishra, Chairman of the entire program, Professor V. Ganeshan, Patron, Professor R.N. Singh, Treasurer of WCOP and Chairperson of today's session, Professor P. Suresh, Core Committee member of WCOP and guest of honor for today, Professor A. Krishnamurthy. Special invitees, Dr. Vijayantmala, who is the Secretary WCOP of Tamil Nadu. Special invitee and today's trainer, Dr. S. Gomati. The President of WCOP, Professor B.G. Reddy. General Secretary, Professor R. Subhashni. The training program coordinator, Professor K. Ashok. All the core committee members, executive committee members, and all the participants of today's session. A hearty welcome to you all for this session number 9 on this auspicious evening. Now, I request our chairperson, Professor V. Suresh, to speak a few words.
Good evening to
Professor V. Suresh has completed his PhD from Annamala University and worked as professor and HOD for the Department of Psychology in Annamala University, Tamil Nadu. Over 30 years of experience in teaching and research. He also worked as the director for the Center of Yoga Studies, Annamala University, Tamil Nadu. And at present, he is now working as the course director for the Care Institute of Behavioral Psychology with psychometric teacher award of Annamala University, Tamil Nadu. He is very much interested in yoga therapy. We are very happy to have you in our midst, sir. I request you now to speak a few words addressing the gathering.
Please unmute yourself.
Right. There are many issues that are growing in schools, and teachers are in a confusion as to how they should go about it. And as a result, the WCOP thought that it would be appropriate to train teachers also so that they will be able to handle whatever they can, and if necessary, they will be able to refer it to some other person also. So it is in that sense, this training program has been organized. It has been going on very well, and an experienced senior professor, Professor Ganeshan, is actually conducting this training program, and this would be useful to the participants once they complete the program, and I wish them all the best, and thank you for the opportunity given. Thank you.
Thank you very much, sir, for your very sweet and short words, and telling us the need for counseling in schools, which is a very dire need at present. Thank you very much. Now I request our guest of honor, Professor A.R. Krishnamurthy, to speak a few words addressing the gathering. Professor Krishnamurthy served as professor and chairman in the Department of Clinical Psychology and as BOS member and chairman of Board of Examination in Bangalore University and Kuvempu University. He's also worked as clinical psychological consultant and psychotherapist in Manasa Nursing Home, Shivamogga. He guided over 20 MPhil and 5 PhD students. With more than 40 years of teaching experience and over 25 years of practice in psychological treatment, he is awarded as the best resource person by Mansa Educational Foundation, Mysore, and Sri APJ Abdul Kalam Lifetime Achievement Award. Sir, we are very, very happy to have you in our midst today. Though you have, we have seen you attending, and we have got the pleasure of listening to your sweet words. Kindly address the gathering, sir.
Good evening to all of you. Thank you very much for the opportunity given to me. I have been attending these training programs continuously, and I have seen how it is benefiting the trainees. So in one study that I conducted about 40 years back, in case of high school students, what are the problems that they go through, and what is the remedy? Does it affect their performance? Does it affect their relationship? And all these things was my intention of the research. So I used Mooney's problem checklist, where there were 330 statements divided into 11 areas. So health and physical development, so on. Even it had a curriculum and teaching procedures as one of the area, where then personal, emotional factors and so on. And in my clinical practice, both in Manasa Nursing Home as well as teaching clinical psychology, what I observed was in high school students, because it is a turning stage. We know adolescents go through stress and storm. And not only that, even the early childhood period nowadays is very painful to some extent because of the lack of cultural and family support. So in this regard, it is very necessary for the trained people to disseminate the information so that others also get the benefit and handle the body in a better way. Otherwise, we have seen a rise in the suicidal rate, a rise in the maladjustment rate, and so on. So in the school itself, if we can help the child to develop a strong personality, is going to be beneficial in preventing many mental disorders that develop at later stage. So in this connection, the trainees will have to equip themselves with most of these procedures, cognitive behavioral therapy, behavioral techniques, and then psychodynamic approaches, humanitarian approaches, and all that. So what they have to do is to gather the information in a full forum, what we call as behavioral formulation, and then find out what they can do to, whether they can involve the parents, also play therapy and so on. So this way, today, as I heard Dr. Reddy announcing about, most of them are phobic reactions, as we have seen. So in phobic reactions, we see some or the other prior condition becoming irrational at later stage. So we have got these, most of them are behavioral techniques that are employed here, desensitization program, relaxation, exposure therapy, and so on. I hope the expert in this regard will guide the trainees. Thank you very much for giving me this opportunity. Professor Reddy insisted me to be here. So I'm regular in the program, attending the program. Thank you very much. And I wish all the best for the trainees.
Thank you very much, sir, for your good wishes and good words. Now I request special invitee Dr. Vijayant Mala, Secretary of WCOP Tamil Nadu Wing, to speak a few words addressing the gathering. Dr. Vijayant Mala completed her PhD from Sri Venkateswara University, Tirupati, and is now working as Assistant Professor in the Department of Counseling Psychology, Madras School of Social Work, Egmore. She started her career as an Assistant Professor in the Department of Counseling Psychology in Madras School of Social Work, Egmore, and guided 8 MPhil students. She conducted many training programs and organized 5 national and international conferences and published papers in various journals. Madam, I request you now to address the gathering.
Good evening. Good evening, Govind Reddy sir. Good evening, Suresh sir. So actually, this kind of program definitely will help the teachers, because teachers, if you take school students, teachers not only play an important role in teaching the academics, so but also they played a very crucial and important role in molding the students' personality as well as their overall behavior. So I think this kind of training programs will help the teachers and also people who are working with children in the school setup. So it helps them to bridge the gap between the theory, whatever they have learned, and also the implementation, which is very important. So there is a gap between the theory and also the implementation when they play a role of a counselor or role of a mentor, right? They find it little difficult in the application of it. So I think these kind of training programs will definitely help them to bridge the gap so that they can function effectively. And also this kind of training is not only needed in the school setup, but there are a lot of areas which has to be focused. So I request Govind Reddy sir to conduct many more programs for other population also, not only for teachers but also for other populations. So with this, I wish all the participants to have a fruitful learning and all the best. Thank you for giving me this opportunity.
Thank you, madam, for your good words and best wishes. Now, I request our special invitee and trainer of today's session, Dr. S. Gomati, to go ahead with the training program.
Good evening to
I have
all.
already introduced Professor Gomati in my previous session, and
Yes,
now
ma'am.
I request you, madam,
Yes.
to go ahead with the training program.
Okay, thank you, ma'am. Good evening to all. Today, the session related to phobia is very important in molding the behavior of the personality and bringing the student to achieve their academic level very best. Definitely, there is some gap in what we study, and in applying the theory practical is very difficult and needs some more experience. And that definitely I will share my experience that what I have come across through the students, and I guide you. And okay, ma'am. Let us share this session, ma'am. Hello. Students can come across the questions what they want.
Good evening, madam.
Good evening, Pa.
I'm Sivarani. Madam, I want to know about fear of being alone, madam.
Fear of alone.
Yes, ma'am.
Yeah. The student, when they fear of alone, most probably the reasons for alone due to a single nuclear family, or when they are asked the severe punishment given by the parent, or sometimes the teachers, they can't able to be when they are alone, they can't able to face do the normal activities. They have some irritation, fear, anxiety. That time, what we have to do is, when the students are referred for counseling, first of all, what we have to do is creating some good rapport with that student and find out what actually the
Madam,
Madam, you are muted.
Madam, please unmute yourself. Unmute చేసుకోమని చెప్పు. Hello, madam.
sir,
Yeah.
first, now only okay, sir. Hello. Sir. Fear of being alone.
Yes, ma'am.
So this causes when the parent
Hello, madam. Madam, unmute yourself. Hello.
I can
Madam.
able to hear you, sir.
No, not like that. You are just unmute yourself and speak.
Now I can you hear me, sir? Hello.
Yeah,
Madam Govati, madam, can you please raise your voice?
I can. Okay, ma'am. Now able to hear, ma'am.
Yeah,
madam.
it's clear,
Hello?
but please raise your voice, ma'am.
Okay, ma'am. Okay, ma'am. Alone, when the fear alone, when a student have some fear of being alone, we can give some systematic desensitization therapy, cognitive therapy, and finding out what is the actual reason of the fear, because of the parent are separated or nuclear family. The punishment given to them is that is the root cause has to be find out. Then make them to use some visualization techniques. Make them to use some 5 minutes for working on the interested areas. And hello.
Madam, please
Hello,
continue.
sir. Tell me, sir, ma'am. Can you hear me, ma'am? Hello.
Yes, ma'am.
Can you hear me? So you make the student slowly make them to sit in 5 minutes, visualize what actually the fear created to that student. Why he has that fear of alone? Somebody, what incident actually happened during that time? That we have to find out first. Depend upon that situations, the cognitive therapy can be given. Make them to be mindfulness, what has to be happened, and rule out the negative thought what comes to his mind, why he has become more fearful when he is alone. Depend upon that situations. If he says, for example, sometimes if he goes on watching some horror movies, and then ask them to rule out not watching that horror movies, what it creates some fear of being alone, and make them to be happy, do some recreational activities, what helps to be happy, and rule out that negative thinking, and be mindfulness, and observe his using some relaxation techniques, and observing what causes make them to write, what are the incidents that cause some phobia when he or she is alone. Depend upon that, we can give some relaxation therapy, or how to overcome that negative thoughts, or what it happens, why it happens, what is the cause of having this phobia, that has to be ruled out. Then ask them to use some recreational activities or gardening based on his interest. Then slowly we can make them to visualize what happens. Nothing going to be happen. Be confident. Having some relaxation. Cognitive therapy is much more effective in making them to overcome this alone phobia when he's alone. don't keep it. I am comfort with some books like that. So what actually we have to do is, whatever may be the phobia, whatever may be the fear, first we have to find what actually this phobia, how this phobia is formed, what is the root cause. That if need arises, we can call parents also, and we have to collect the data, histories. First, that will help to we can apply whatever therapies we behavior therapy, what is more apt for that student can be given. That can be studied by making some rapport with the student and calling the parent or the teachers. Some incident has been happened. That has to be find out and slowly making them to sometimes we need desensitize that fear that when he is alone, some incident may be happen, some terror incident depend upon that situations or that problem has to be first identified with the help of the student or with the help of the parent or teachers. Then only we have to apply that therapy. Then only it will be more effective. That is whether you want to tell me any apt situations what you come across. Hello?
Pardon, madam?
What I am telling, whether you need still more clarification or any other cases.
Madam, it's clear, madam. Thank you very much.
Okay, thank you.
Thank you, ma'am.
Okay.
Good evening, ma'am.
Good evening, sir.
I'm Durga Bhavani. And my question is on claustrophobia, ma'am. How to control the claustrophobic behavior of the child, like fear of closed places.
The students, most probably the children's, when they are brought up single child, very protective parent or very anxious parent, when the student, how they associate, when they are exposing to some situations, some embracement, some criticism occurs, they can't able to face that. When they can't able to handle the situations effectively, slowly it becomes a phobia. So what actually the child do, they will be escape or use some defense mechanism. It also, this claustrophobia tend to lead on other phobias also. They can't be able to mingle with other places. Most probably, these students are very shy, having some inferiority complex. When they come across more situations related to some criticisms, they can't, when they have more anxiety, that we have to first identify the actual, whether the criticism has occurred, where, in which closed places, whether in school, some students are escaped from the school going, that we have to, again, you have to collect the history. Some functions, when they go for some functions for fun or for some activities, they criticize some incident. They can't able to face or handle the manage these situations effectively, and slowly the child will withdraw from these situations. So what we have to do is, as I told earlier, first we have to talk with the student, why, how he feels, why he can't able to face that normal life, normal incident, whether in schools or some functions or somewhere, that has to be where, when the student can't able to lead his normal day-to-day life activities, where he feels comfort, where he feels discomfort, that situation has to be analyzed. For example, if he has the fear of criticizing family functions, you have to first create some confidence and take it as easy everything. Make that be bold and not to be fear of facing anything, and giving some positive thoughts, relaxation techniques, and slowly making them to bring to the places, slowly to functions, making some giving assurance. The parent has to handle. For example, it is some family functions. What we have to do is ask the parent to to watch and to handle, to be always with the children. And if somebody comes and talks funds like that, be a supportive and make them to be a good, create some good relationship. And slowly the student will come out of the problem. Sometimes it occurs in a school. Some students will not go for a school. Some students will be more criticizing. He can't able to face that problems. In that cases, we have to call that student also, talk to them, and make them to be friend and take it as a easy sense. Most probably the cognitive therapy will be more effective in making them to come out of this claustrophobia and giving assurance and making the friends to be confident with them and make them slowly deconditions this some conditional instant will create this, slowly the phobia will occur. Nearly 6 months. The symptoms will be definitely, you can observe only already it has occurred slowly when the fear will be, when he can't be able to face any situation, irrational fear, when he is not able to comfort in normal situations. That situation has to be find out, and what therapy is apt, whether it's a systematic desensitization or whatever the therapy that has to be given means, definitely the student can come out of that problem. Need any clarifications?
Thank you, ma'am.
Okay, thank you.
Good evening, madam.
Good evening, ma'am.
I am Lata Bhavani, madam.
Yes, ma'am.
Madam, how to control lack of respect towards teachers, madam?
How to?
How to control lack of respect, madam? Lack of respect towards teachers, madam.
Oh. There's some students
Yes,
talking very bold, you know.
yes,
That
yes,
is,
madam.
some students say they doesn't know how to behave. That it arises from home itself, from the
Madam.
home, how the parents are brought up. Sometimes the child may be, most probably whatever the we are handling the cases. First, we have to collect some personal data using, then only we can find out what is the reason for behaving like that, not giving respect. Sometimes, for example, in some family, the child may be born very late. He's a only child. The grandparents are they will be very enjoying the talk. They doesn't, if the children talk something, even grandpa, the name or call it, or even whatever telling, they just laugh. They won't tell, you have to give respect, you have to talk like that only. So it starts from the home itself. This behavior problem start at home. The most probably the child doesn't know, the student doesn't know how to talk, the relationship, how to give respect to the teachers, how to behave in social conditions. In that cases, definitely we have to call the parents and ask his histories, ask the histories, how the child has brought up, or sometimes it may be they will be they allow the child, neglected child. some trauma, have they can't, they will be working. They allow the child in the street playing, they go for tuitions. In that, the bad companies also, they have this type of habits. So what we have to do, first find out how this habit has come upon, and we taught the child, student, this is not good habit. You have to impress, giving respect. If you like that, how you treat the lower student. If they ask you by name, how you feel, you are expecting the lower class also to call you as a brother or giving some respect. Like that, you have to talk.
Okay.
And sometimes the teachers also need some counseling. Sometimes the student will not respond to all the stuffs like that. Some painful incident with the teachers, he or she may be not studying good or touching some behaviors. They talk some rude to the teachers also sometimes rude to the students. That also, if it is that means we have to talk to the teachers also, and that circumstance also to be nullified, and slowly giving some follow-up sessions. And how you get, if you talk like that, you get the punishment. That cognitive therapy will be more effective in
Okay.
bringing this type of children.
Okay. Thank you, madam.
Thank you.
Namaste, madam.
Tell me, good morning.
Good afternoon, everybody.
Sir,
Yes, this is Chennareddy, teacher from Kadapa, madam.
hello.
Am I audible, madam?
Hello, not audible.
I am Chennareddy from Kadapa, madam.
Tell me, sir.
I am a teacher. Madam, what are the main reasons for acrophobia, madam? And how can we teach the students? What is its impact on students' personality, madam?
Acrophobia. When they are in a, they can't able to face when they are in some closed surfaces. When they are in a circumstance, some circumstance, they can't able to be handled that situations. In that situations, they can't be able to handle that the anxiety will be more anxiety disorder only. So they can't able to do the normal activities. This happened due to the neglected parent or harsh handling parent. Some situations when they come across by criticisms, they can't able to face that situation. Slowly it forms. It can be given by giving some behavior therapy, the cognitive therapy, and systematic desensitizations, where he feels some fear more, that can be rectified.
Good evening, ma'am.
Good evening.
Good evening, ma'am. My question is how to get rid of fear of lifts, ma'am. Fear of lifts, yes, ma'am.
Okay. So, nowadays, wherever we see there is elevators, definitely we have to go move on that. Some children or students, when they have not having more circumstance or environment to come out, some students, they have family situation, they will be going out more and more. Some they won't have many exposures, and having some terror or about negative imagination. More child may be brought up itself very fearful. The parent may be also anxious. So in that cases, it will be developed. It's very apt technique is using systematic desensitization technique with relaxation techniques. We have to talk to the student. If we talk about the make them to point out where the hierarchy level of anxiety rising, that has to be noted. Initially, you make them to visualize. Then, for example, if you go for lift, make them to visualize or imagining I am in the lift. Then doing some relaxation technique. After that, slowly at next step, by picture and looking some distance and making some relaxation technique. Slowly we have to desensitize the how the fear increases to higher and make them to touch, make them to observe others, how they are moving on the elevators or lift like that, and giving some support. Likely, then the fear is slightly, slowly, it will be desensitized. So the sensitive can be desensitized by slowly giving exposure, not giving, taking the child directly to the lift or elevator. It will create more anxiety or fear. So in that cases, that method of therapy is the relaxation technique with the systematic desensitization can be applied for that. You can easily make them to then overcome this type of fear.
Thank you, ma'am.
Okay. Okay.
Good evening, ma'am. I am Dasha Gaud.
Good evening. Okay.
Madam, one case I would like to bring to your kind notice that runs to fear of blood. One boy of 15 years old feared on seeing blood.
Okay.
I inquired into madam. His father said when he was at 7 years old, he has seen cutting a goat, neck of the goat. Thereafter, he has stopped taking non-veg and fearing single drop of blood, madam.
Cutting the what? Cutting?
A goat.
7 years? What?
Goat.
Goat. Okay. Okay. So yes, exposed to that shop like that. Okay.
Yes.
So what we here also, what we have to give is some exposure therapy, making some robot. It's some terror has it's make them giving some counseling, confident. It's not like that, and not only that incident has created that type of situation. Definitely forthcoming situations also, you maybe watch some horror movies also. One incident will not happen like that. Definitely he may come across several incidents like that, or he maybe think of that thing only. Always he was imagining about what he has seen in that age. He can't able to come out of that situations. So in that, what we have to do is we need more clarification with that student. Only that incident has happened, or many other incidents later to that he has seen that incident or heard like that. We have to find out and make them to give some cognitive therapy, and now be mindfulness, not to think of the past, or not to think of irrational beliefs. Yes, got some irrational fear of blood or cutting the coat. We have to make them to it's natural. What has done is that has to be given some therapy and talk to that parent also. And first, in that the irrational beliefs has to be erased, giving some cognitive therapy, some systematic counseling, and asking them to then also some desensitization technique also very effective in slowly asking them to talk about this, what all we do is not harmful, and it is what is rational only. That mindset has to be given. Then definitely he can able to come out of that problems. Definitely we have to make them to erase the past, what he strongly have some irrational thought on his mind. Then definitely we can able to make him to come out of that fear. So. Any clarifications?
Thank you very much.
Okay.
No more questions, please. Or anyone is ready to ask the question for madam? Ramadevi. Ramadevi. Or anyone else from audience? Okay. Then shall we go for vote of thanks? Okay, Dr. Chinni Simon.
Sir.
Yeah, please go for vote of thanks. I think more or less 7 problems covered. Dr. Chinni Simon.
Hello.
Yes, yes, please go ahead.
Hello.
Yes, you are audible. Please go ahead, madam.
Okay, sir. So we had almost done with 6 problems today. And I'm happy to thank each and every one of the participants who have come out with the problems. I hope Madam has clearly mentioned the solutions for it. I extend my heartfelt thanks to all our chief patrons and patrons, the chairman of the chairperson of the program, Professor V. Ganeshan, Professor Ramurthy, Professor Girishwar Mishra, and the treasurer of WCOP and chairperson of today's session, Professor V. Suresh Garu, the core committee member and guest of honor, Professor A.R. Krishnamurthy Garu, the special invitees, Dr. Y. Jayantmala, and special invitee and trainer, Dr. S. Gomati Garu, who has given good solutions to the problems raised by the participants. I also thank President WCOP, Professor B.G. Reddy Garu, and General Secretary, Professor R. Subhashini, Treasurer, Professor V. Suresh, and the training program coordinator, Professor K. Ashok, all the executive committee members, core committee members, and all the participants. Thank you all very much for participating in this program and making it a success.
Yeah. Thank you, one and all.
Thank you, sir. Thank you.
Just for next program, I request the participants. I think you might be experiencing a novel problems rather than routine problems. I think you are the best people. You can give your richest experiences in the form of problems. Kindly just keep your problems in your that is WhatsApp group. Kindly At least each person, at least one problem, if you just place it in that WhatsApp group, then it becomes a a major help to the organizers. So it is once again, thank you all. Good night, everybody. We'll see you in the next program. Good night.
Thank you.
Good night, sir.